Judy Smith, my name is Ariel. I'll be your doctor, helping you along this semi-high-risk pregnancy. Our expectations over the next 30 weeks can vary based on results from screening and testing. There are quite a few tests you can take as of right now. A couple common tests you can take in the first trimester are, of course, HGC testing. It's kind of the initial test for pregnancy. You can take them at home or in a lab. They basically tell you whether or not you are pregnant. Next is the PAP-A test. It is a test of a protein, and it will test for symptoms of Down syndrome, kind of like screening for abnormalities. You could also get an ultrasound, a nuchal transparency ultrasound. It analyzes the space behind the fetus's neck. It looks at the amount of fluid there. There's a normal amount of fluid, a standard amount of fluid, but if there's anything that could be abnormal with it, that'll require further testing. There's chronic villus testing. It's from a placental test. It's a sample taken from the placenta. It can be done it is usually recommended for higher risk surgeries such as geriatric pregnancies like you have, and it can look for chromosomal abnormalities that can cause things like trisomy 18 or Edwards syndrome, Down syndrome, Patau syndrome. Cell-free DNA testing. It will test the blood of the mother. It finds DNA cells that are from the fetus in the blood of the mother, and it can find other chromosomal abnormalities such as the 3 trisomies, Patau syndrome, Down syndrome, and Edwards syndrome. It can be done during the first or second trimester, whichever you prefer. During the second trimester, there's also AFP testing, alpha-fetoprotein test. It is recommended for higher risk pregnancies. Higher levels of this protein can be caused by many different factors, and it can cause multiple other genetic abnormalities and health issues such as hepatitis A, B, or C. DIA testing is recommended for higher risk pregnancies as well because it can test for gestational diabetes. UE3 tests the fetal syndrome. Once again, test for any abnormalities in the chromosomes or the genes. It can test an adrenal deficiency in the fetus as well. You are also recommended to get an anatomy ultrasound in your second trimester. This will kind of give you a solid look at the fetus, see how it's developing, see if there are any defects or abnormalities in the body in its presentation. It can also be used to determine the sex of the fetus, which, if you would like to figure that out before the fetus is born, we could do that. Amniocentesis is a sample of the amniotic fluid. It can test for infections of the womb or the fetus or the mother. It can cause significant risks as well if it's done too early. These all risks are rare, but they can happen. This is done using a sample. So we would use a relatively small needle and we would sort of extract some amniotic fluid to test, and this visual right here kind of gives you the idea of the different tests you can do, when you could take them. As you can see, the cell-free fetal DNA analysis can be done at any time during the first and second trimester, and the reason that the third trimester is not in this visual is because usually if you're getting a test in the third trimester, it's because one of these tests before have shown something that needs to be further looked at. Once again, all of these tests are just recommended. You are not required to take them, but it is very recommended, especially for a higher risk pregnancy such as yours. These tests are used to figure out if the baby is developing normally. As of right now, all of your tests have been normal. So just let us know which test you'd like to take. Let us know how you are feeling. Let us know what we can do. And if you have any questions, don't be afraid to ask. Just let us know.